I'm Dr. Shauna Levy from Tulane University, and I'll be discussing metabolic and bariatric surgery accelerates the path to kidney transplantation. We have no disclosures. Obesity is a common problem in the United States, with nearly 40% of the population suffering from the disease of obesity. End-stage renal disease is a common comorbid condition amongst these patients. Unfortunately, obesity is also a barrier to kidney transplantation. We hypothesize that metabolic and bariatric surgery will improve access to kidney transplantation, as well as increase the rate of kidney transplantation amongst patients on the transplant waiting list. We evaluated our hypothesis using the Trianetics database, which covers over 98 million adult patients from 65 healthcare organizations. Our study focused on patients with a body mass index greater than 30 who also had end-stage renal disease or are on dialysis. We compared this with patients who underwent bariatric surgery to a control group who did not. We used propensity matching to be able to evaluate these patients and try to minimize differences between the two patient populations. We evaluated 132,989 patients, and of which 6,263 underwent metabolic and bariatric surgery. In our results, we found that 19% of metabolic and bariatric surgery patients were able to make it to the kidney transplantation waiting list, but amongst the control group, only 10.5% were listed. Additionally, among patients who were on the wait list, 27% underwent kidney transplantation versus only 16% of the control group. The mortality rates were lower amongst patients who underwent metabolic and bariatric surgery as well as kidney transplantation at 30.55% versus 36.44% in the control group. On subgroup analysis, we found that cardiovascular complications were lower and amongst patients who went metabolic and bariatric surgery at the 2 and 10-year post-transplant assessment. This study had limitations similar to other database studies. In conclusion, our findings suggest that metabolic and bariatric surgery not only improves the likelihood of transplant waitlist activation and successful transplantation, but also reduces cardiovascular complications post-transplant. This dual benefit underscores the potential of metabolic and bariatric surgery as a transformative strategy in managing patients with obesity and end-stage renal disease, ultimately accelerating their path towards kidney transplantation. Thank you so much.